ahead.
Okay, how many of you have had braces before? Nearly everyone. Okay, how many of you wear glasses or wear contacts? Still a great amount. Now, these are two of the most common things that society pushes people to conform to. Why do people have contacts? Because they don't want to wear glasses, because everyone doesn't wear glasses. People have braces because society makes you feel like your teeth need to be straight. But these are things that you just can't help. It's not your fault that your teeth aren't straight and that you can't see. I can't see that if I go to the eye doctor because I wear glasses. Now, hyperhidrosis along with speech anxiety, panic disorder are something that people have and can't help, that social settings are, they're put in social settings where they can be judged. Society makes people feel like they need to torture themselves out of specific things such as poor eyesight and bad teeth, especially hyperhidrosis. And the more society pushes people into these hard situations, the worse they feel physically and emotionally. They shouldn't impose methods like braces and treatments that I'm going to present to make people feel normal. Now, with hyperhidrosis, there are 4 treatments, and these are the first 2 that are less expensive. The first is Drysol, which is high-strength antiperspirant. According to WebMD, doctors recommend Drysol when regular over-the-counter antiperspirants don't work. And Drysol contains 5% more of aluminum chloride than deodorants like Secret and Degree. They contain about 20 to 25% of this active ingredient. You have to apply this 2 to 3 times a week before you go to bed, and this generally works, but it can cause skin irritation and sore red hands. The next is iontophoresis, which is generally prescribed by a doctor for hands and feet, when your hands and feet sweat. Now this, you can see they have hands in the water, but what is hooked up to it, you place your hands in the water and they send electrical currents through the water to numb your nerves so you won't sweat. They generally stop electricity once the patient feels a tingly feeling, but afterwards your hands still tingle and they hurt, and the problem is you have to constantly reapply this, or the sweating will reoccur frequently. And some are content, but it's very time consuming and discomfortable, and it's always not covered by insurance. So this can be very expensive. You have to get this done monthly. The next 2 are Botox and ETS, which is short for that. Botox is one of the most poisonous poisons known to man, and according to WebMD, it was approved by the FDA in 2004 for severe auxiliary hyperhidrosis, which is in your underarms. But in small amounts, it can reduce the transmission of your sweat nerves. Now, in the underarms, they stick you 20 times, and in the feet, between 70 and 90, depending on if you're male or female or how big your feet is. Now, why should I have to get Botox in my feet? Why can't my feet just sweat? It blocks nerves that stimulate the sweat between 2 to 6 months, and it causes pain in the area. As you can see, you have holes in your feet, and it can cause flu-like symptoms, mild weakness, intense pain, and it is costly and not covered by insurance. Now, ETS is the most drastic, which is surgery, and this is the most expensive because it's not covered by insurance companies. Basically, it removes the nerve that sends a signal to your sweat glands. That carries great risk because they put you to total sleep. They cut an incision under your arm, under each arm, collapse both lungs because they have to get to the nerve, and they stick an endoscope in to see the nerve, but they can pinch another nerve in the process, and this can cause inability to raise your heart rate when exercising, unable to control your body temperature, can cause very dry hands and feet because the nerve is gone, or it can cause you to sweat more in other places. Like it can only do your hands and your face because that's the only nerve they can get to as of right now. It can cause lung problems because they have to collapse both lungs. So when you relapse it, it can cause problems. And these problems are irreversible. According to hyperhidrosistreatment.net, Sweden, which was the birthplace of ETS, banned it in 2004 due to massive complaints by disabled patients on the irreversible causes. In 2006, Finnish Office of Health Technology showed strong indications of side effects for this surgery. Okay, these are the 4 treatments for hyperhidrosis, but they really aren't treatments because the side effects outweigh the treatment because you have to get it redone. Nobody wants to have a bad lung due to just because they sweat. Now, the International Hyperhidrosis Society is a nonprofit organization that strives to help the lives of those suffering with hyperhidrosis, and they provided all these statistics based off of evaluations of their patients. 90% are socially embarrassed. That means I couldn't be standing up here right now speaking to y'all because I'd run out because my hands would be sweating. I'd just be so nervous. 77% avoid handshakes. I wouldn't shake anyone's hand if I had an interview. They would just avoid it. No, hi, it would be really awkward because they're self-conscious about their sweating. This really affects their personal and social life. 34% are unhappy just because of this disorder, regardless of anything else, school, work, everything. 34% are happy because of this disorder. 17% wear gloves during a test. Like if they type in the paper at night, gloves, because it can mess up your keyboard. This also interferes with people's social lives and daily tests. It puts a burden on social situations and interferes with everyday tasks. Like playing instruments, I used to play the clarinet, but I stopped when I found out I had hyperhidrosis. Can't grip tools, drop glass, you get electric shocks when you plug in things because your hands are sweaty and the sweat. Even touchscreen phones, I can't, do my little swipe to get my code in. I have to wipe my hands off first. It also causes occupational difficulties. According to sweathelp.org, a college professor was embarrassed to find out he has auxiliary hyperhidrosis. He was embarrassed to find out that his students would make bets on whether or not his sweat would reach to the end of his belt by the end of class. Now this is very embarrassing for an established professor. And it's distracting because it causes people to lose their focus because he's worried about what his students are betting on instead of doing his job. As you can see, hyperhidrosis is something that people want to fix, and it's not fair because we can't help that we sweat. The treatments don't really work, and it's a waste of money that builds up hopes of becoming normal according to society's idea. It takes a toll on emotional stability and causes social embarrassment, and if people were more open-minded to people's differences, then these things like Botox and ECS wouldn't exist for people to want to feel like they need to get. And if everyone just accepted people's differences, then people will be happier. 34% will be happier with hyperhidrosis.